Namaste, and welcome to our continuing series on homeopathy with our beloved Dr. Pachegaonkar. Today we have decided to speak on sleep apnea, which is becoming rather a common thing.
Yes.
Of course, it was always said that you have to sleep on a different side or something. And why don't you cover the whole subject for us?
Sure. Sleep apnea itself indicates that it's a term used for a difficulty in breathing during sleep. And see, the physiology is this, that our respiration is regularized, monitored by our respiratory center in the central system, brain. So each moment, the blood passing through this respiratory center is analyzed for oxygen saturation, and depending upon the need, the respiratory rate is monitored. This is a normal physiology. Like if I am running and my body needs more oxygen, so definitely that respiratory center realizes that oxygen saturation is falling and it activates and you start breathing fast. So this is regulated and it is like not a voluntary function. Involuntarily it goes on, autonomous, independently. During sleep, what happens? That the whole body goes in hibernation. And when body goes in hibernation, definitely the requirement of oxygen may be less. Consumption won't be that much.
Certainly, yes.
And so the respiratory center also allows it to breathe slowly, and as per requirement, the breathing is monitored. Sometimes this respiratory center also goes in hibernation and it is not able to monitor it to the optimum degree, and suddenly the oxygen saturation depletes, and then suddenly you start getting awakened, or the sleep also gets disturbed. And sometimes because of inadequate breathing and disturbed sleep, you don't feel fresh in the morning when you wake up. So many people even don't realize the phenomena of sleep apnea. And some people, they just complain that they don't feel fresh on waking up, they feel as if they need more sleep. The person may sleep for 7 hours, 8 hours, 9 hours, but will not be fresh as one should be after sleep, and therefore they suspect sleep apnea. And now last 15 to 20 years, this has become a fashion now, that they just put a device which measures it, the quality of respiration during sleep, and then they declare that the label that the person is having sleep apnea. And now they put an artificial device which regulates breathing during sleep, and then the person becomes almost dependent. And once you are like used to sleep with this apparatus
What
on,
is the kind of apparatus? What does it look like?
it is simple apparatus look like, but it regulates the breathing. But once you apply it, it becomes, you become dependent. So what we do is, in homeopathy we have wonderful remedies for sleep apnea type complaints. Mainly some people feel that it is adenoids which cause this. Adenoids is something, a lymphoid tissue in the retropharyngeal area, and that nasopharynx gets blocked, and because of the supine position during sleep, the person undergoes sleep apnea. This is hypothesis. But people who don't have hypertrophied adenoids, they also experience sleep apnea. So best thing is, we have remedies where the respiration, oxygen saturation is monitored, and even the energy level depletion during sleep also is monitored. For example, we have a zincum metallicum like remedy. It's the same zincum metallicum from chemistry. This remedy actually regulates this, that the person who gets respiratory distress and wakes up from sleep, The zincum metallicum actually monitors the vitality of the person, and that vitality becomes stronger. And even during sleep, the respiration is regularized properly, and person can wake up as fresh as one should. Then there are even other remedies like Baraita carbonicum, even Noxomica, where the quality of sleep also is monitored, and then the person feels fresh on waking up. But we have seen some people, they correlate it with snoring. There are people who snore easily, and they feel snoring is also one indicator of sleep apnea, because they say snoring is something which is related to the what we can call force breathing, and that creates a sound, and that also can be because of sleep apnea in the background. But we have seen some people, they snore but there may not be sleep apnea, their oxygen saturation is well maintained. But here, as a physiotherapy, what we suggest is we ask them to increase their vital capacity. Some breathing exercises, especially deep breathing exercises, where inhalation and exhalation ratio is maintained. We ask the person to start taking exercises with 1:2 proportion of inhalation and exhalation. Then slowly we ask the person to advance further to 1:4, even 1:8, where
Yes, inhaling 1:1.
inhalation and exhalation 1:8 also one can go, but uh, average would be 1:4.
Is there a holding period?
Of course, holding period we don't recommend in people who have the tendency of hypertension. So what we do is, instead of holding, what we call kumbhak, instead of holding both times after exhalation and inhalation, we ask the person to inhale completely and slowly exhale uniformly and slowly to the complete extent, so that the vacuum is created, and then allow the system to breathe in inhalation.
That seems to me to be the simplest.
Yes.
Yes.
So here inhalation is almost, natural. It's because by exhaling completely, you have created vacuum. And once you exhale and then allow the inflow of air, inhalation goes much natural and it's instant. So once you start practicing, maybe in 3 months, one can reach up to 1:8. And I have seen with practice, people are practicing 1:8. So one breathing cycle, inhalation and exhalation without holding, can be like 41 to 46 seconds. So on an average, in there would be just 1.3 cycles per minute, and this gives wonderful vital capacity, and the person will not have experience of this sleep apnea. So slowly we ask the person to take this exercise. Plus, even some people sleeping with full stomach, when actually we advise that there should be 2.5 to 3 hours gap between bedtime and dinner. So if people by chance they become late for dinner and they eat, and because of tiredness they fall asleep quickly, they also experience this sleep apnea. And so we advise people to keep adequate gap between dinner and bedtime. Then even the position also matters. We have seen
Position of the body.
body during sleep.
Yes.
Our professor of physiology in JIPMER, he has done these experiments, Dr. Pal, that where you are lying down with prone position, and then you don't tend to have this sleep apnea. Only some people who have this tendency and they are lying down in supine position during the sleep, they experience sleep apnea more.
I had it.
Yes.
And I had it in the same way when I was lying on my back.
Yes. So,
And
but if you lie down in prone position, then you don't tend to get it.
Prone, huh?
Prone means lying on abdomen.
On abdomen.
On abdomen. So completely prone position on side, if you are lying down, then you don't experience this. These are all what we call immediate measures. But definitely the breathing practices, homeopathic remedy, and then gap between dinner and bedtime, these things will definitely help you to overcome sleep apnea. And moreover, it is again a psychological also. Like there are people who are under stress, and they are not able to overcome the stress even during sleep. And then the sleep is a cyclical phenomena, and if melatonin is not secreted properly, their body is agitated, the systems are not synchronized properly, and then again the system may overreact. See, the oxygen saturation, if it is falling, the respiratory center should swiftly stimulate breathing. It need not be agitated, and in that degree they should suddenly start respiration to be fast. That is not required. It should be a very swift and gentle response, even if it is involuntary, automatically. But during sleep, some people get agitated response, like a knee jerk response, and therefore also they get awakened. Their sleep is disturbed, so they don't feel fresh. So it is not always the vital capacity, but even the mind and the stress, that also can lead to this sleep apnea.
When I had it, I didn't know that I had it until I heard myself snoring. And then I woke up, and then I
Exactly.
knew that I had it.
So maybe the snoring is so loud that your sleep gets disturbed,
It woke me
or
up,
it
yes,
wakes
yes.
you up, or it can be the fear or the oxygen saturation getting depleted. That also can keep you awake, and then you realize it.
Yes.
But many times we have seen that the patient is not aware of that. The doctors diagnose that maybe you have sleep apnea, and they measure it and they put the device, and then the patient starts feeling comfortable and start using it, and then becomes dependent on it
Yes, exactly.
psychologically.
Is there any better position, let's say left or right side, to sleep?
See, like if you see, left side is always supposed to be the best.
And that's on the heart. That's where you're sleeping.
It's actually what happens, not on the heart, we can say, because it is in the cage, like the heart has good support.
True.
But it is mainly because of the stomach position. You see, stomach has body on the left, and it opens up to the towards right,
Okay.
what we call pyloric end. Pyloric end is opening in the duodenum, and that is on the right. So when you are lying down, especially when you are lying down with food in it, so lying down, in Sanskrit we call it Vama Kukshi. So on left side, if you lie down, it is most comfortable position for your stomach to contain it and allow it to function. But otherwise, we find, like, we have some drug peculiarities where some people are comfortable while lying down on right side,
On the right side.
left side. But definitely supine position, we have seen that some people have breathing difficulty. Yes, supine position, lying down on back straight. Maximum people, so they get like a prone position. They use, like, they get elevated pillow. They take piles of pillows to make them like erect position, and they are comfortable. But then it becomes habit again, and it has much to do with even your hyperacidity, like conditions where the stomach has more acid secretion, and that also irritates, and that also gets aggravated while lying down, especially people with hiatus hernia in stomach. But always the prone position, lying on abdomen, helps in breathing as a temporary measure, but not necessarily that everyone should sleep like that. But if you have discomfort or sleep apnea like syndrome, you can definitely initially try this position and enhance your vital capacity and overcome this disorder. But these homeopathic remedies really help.
We heard years back that sleep apnea could be fatal. It's not true, is it?
See, depends. If you have some underlying pathology, then it can. It can. We have seen, especially during in pediatric age, infants especially.
Yes.
In infants, it's a syndrome that acute respiratory failures are there, and but there are rare incidences. But definitely, it is hazardous to health. Sleep apnea, if it is continued, definitely it's becomes a vicious circle, in the sense like your vitality goes on depleting, you are not fresh every day, you don't get proper sleep, or the quality of sleep is depleted, then your immunity comes down, then you become susceptible to so many disorders. It is like that.
Very good. Good. Thank you so much, sir. Namaste. Namaste all. Thank you.